Hi, my name is Erik. I'm going to be presenting on the topic Advanced Care Plan for a Palliative Patient. An advanced care plan offers certainty about end-of-life care for a patient, the family, the treating palliative care team. Through structured and meaningful conversation, the patient is empowered to open up and document about their preferences and wishes regarding management of their illness and the location of the delivery of their care. An ACP enables healthcare providers to proactively plan the patient's treatment more effectively, and it promotes patient-centered care that is in line with the patient's wishes. This leads to a better quality end-of-life care and improves confidence in the healthcare services, resulting in a greater satisfaction by the patient and their loved ones. For the family, it reduces the decision-making burden as the preferences have been documented before the patient has become cognitively incapable. It also helps them understand what is expected during the palliative care process and the end-of-life care. Overall, the aim of the ACP is to limit uncertainty for everyone involved in the palliative care process and when the patient can no longer make decisions and speak for themselves. By having an ACP in place and limiting uncertainty, the patient and their loved ones can experience less anxiety, stress, depression, and also more satisfaction with their care. Decisions relating to palliative and the end-of-life care can be particularly difficult and involve complex ethical considerations. All the ethical frameworks have an element of guiding ethical nursing practice and aim to set professional standards in nursing and help with sound decision-making. The four principles of ethics are autonomy, beneficence, non-maleficence, and justice. Today, I will talk about autonomy and non-maleficence in more detail. The patient's autonomy evolves in respecting the rights of the patient and to make their own decisions in relation to their preferred future healthcare. The healthcare team can improve patients' autonomy by promoting supporting decisions, which include giving them information of their options and their care on case-based approach to help them make informed decisions. Specifically in relation to palliative care, the patient's directive in the ACP extend autonomy to the patient to ensure that their preference is honored during period of temporary or permanent impairment. Non-maleficence is the principle of not causing needless harm or injury to the patient and treating them without malice. This requires weighing up the relative risks and benefits of any treatment action and inaction to the patient. Some treatments may cause a degree of harm, but with the benefit of the patient outweighs the harm. For example, in the case of palliative care, it is the patient, if the patient is near death and in pain, by administering pain therapy, the patient will become more comfortable. However, this may also accelerate death. And in this case, the nurse has a moral obligation to give relief of symptoms, even if the intervention might hesitate death. More effective communication is the key component in developing a strong therapeutic trust relationship in the palliative care setting. Conversations in a palliative care are often more difficult and complex than other clinical settings. The patients and their loved ones are often feeling emotional and distressed. Open communication is a key component in a high-quality palliative care, and it involves asking open-ended questions, which allows a space for the family or the patient to raise topics they would like to discuss. It facilitates the family by giving their perspective before influenced by the healthcare professional's opinion. It also helps the clinicians to understand the needs of the family and ensuring that there are no confusion about the care or illness. It ensures everyone involved in the care agrees and understands the process in which relates to the relief of the stress of the greater readiness for the upcoming outcome. Within open communication, nurses are required to use active listening skills, empathy, and patient-centered approach, be clear, calm, and attentive to visual and nonverbal cues. Poor communication between healthcare workers and the family can result in distress, anguish, confusion, and dissatisfaction. In conclusion, the advanced care planning has many benefits and requires ethical decision-making and effective communication. Thank you so much for listening. Have a beautiful day.